Shalini from Akshara Global Academy. Today I am giving you the writing correction for OET. Let's see. Below. That is, you are working as a staff nurse at Apollo Hospital, Brisbane, where Mr. Jimmy Davis is admitted. So here the letter, you can see that patient detail, age, address, admission date, discharge date, medical history, and some of the data, and they are showing the prognosis of the patient. So the starting date is on 5/4/19, and next day 6/4/15/4/36 6. So these some of the data you can see that, and the prognosis of the patient is seen. Next section we can see that some other data, and we can see that physio review and MRI, BP of the patient, and physiotherapists and speech language therapists is seen the patient. Finally we can see that nursing care plan and some of the advices the patients needs to get, and finally we can see the writing task. So I told you that this writing task, first you have to read the writing task. Thereby you can see that write a letter to the manager, that is aged care nursing home, and informing him or her about patient's discharge, informing him or her about the treatment provided, care given, and patient's condition and discharge plan. So what I said is, first you have to read the writing task carefully, and after that you have to read the case note. So in this letter I told you this is a non-case letter. So how we detect the non-case letter is, finally the writing task they are mentioning the date that is exactly same of the patient address. So that means it is a non-case, the same person that is receiving the person. So it's a non-case. According to the non-case letter you have to write this writing task. So what are the data needed for a non-case letter? So the medical history, all the things we can skip there. So that means in the letter he's reading the non-case person. So that means the reader doesn't require the medical history data that the person already knows. So other thing, that means newly things, what are the hospital details and what are the after the admission details, everything you have to mention in this letter. So first you have to write the letter date. So I will show you how to write. So one of my students letter I am sharing here. So but thereby you can get an idea regarding how to write this letter. So let's see. Let's see. First the manager, that is address is writing, and Sam aged care nursing home. Then he's writing the date. Either you can write a first date or address. Next is salutation, that here is the manager, so the person is manager, so we can write the salutation as dear manager. Next is reference, that is the person who is how he is referring, that is Mr. Jimmy Devos, age 66. Next is the introduction para. So let's see how to write. The student is writing the letter. So the introduction, the student is writing like that. I am writing to update the health status of Mr. Jimmy Davis, who requires further care and management at your service. He is recovering from stroke and is scheduled to be discharged today. So this is wonderful writing. That means the introduction, my student written very well. So this is the way how to write this introduction. And second para, we are writing the admission history. That means the Mr. Davis was admitted on 05 April 2019 with the suggestive features of the diagnosis. A series of investigations were done which confirmed the diagnosis along with an X-ray and MRI. Supportive treatment was provided accordingly. He has been initiated with the physiotherapy, speech and language therapy, which need to be continued with the help of the respective therapist who will visit him once a week. Next para, we can write like this. On the following days, Mr. Davis has been responding well to the treatment. He has started having soft, solid diet. Therefore, please provide him a low salt diabetic diet and advise him to take plenty of fluids and fruit juice. He has been commenced on warfarin 7 mg per day, for which his INR levels need to be checked every Monday. The level has to be maintained. The level has to be maintained between 2 to 3 and warfarin dose is to be given accordingly. His INR reports have to be sent to the physician. In addition, insulin regular 12 units twice a day has been started. It is paramount to check his random blood sugar levels every 8 hours for the first week and then weekly once. Next paragraph we can write like this. Mr. Devos mobilizes with the help of a frame. Therefore, kindly encourage him to walk 15 to 20 minutes inside the house for the first week. His vitals are stable. However, it is important to monitor him and inform urgently if there is any changes. Kindly help him with the activities of daily living. The final para is, it would be appreciated if you could arrange a staff nurse to assist him with medication. Please provide him a calm and peaceful place to have a good sleep. Finally, you can write, should you have any queries, please do not hesitate to contact me. And finally, you can write yours faithfully and staff nurse. So here they are mentioning that you are a staff nurse. Thereby, we can write as staff nurse. Okay, this is the end of today's section, and in future also I will give more writing corrections, and you can, for that, getting the video update, you can like, share and subscribe my channel. Thank you.